you for joining us this morning to explore whether virtual workshops can be as effective as face-to-face workshops. I'm Kirsty. I'm joined here in rainy Sydney with Grant. Grant's going to help with chat and questions, so say hi, Grant.
Morning, everyone.
Yeah, I'm also joined with Jarrad O'Brien, Executive Director, Human Centred Design at Commission on Excellence and Innovation in Health in Adelaide. Hi, Jay. So this morning we're going to be discussing the how and why of virtual workshops. The last few months have brought challenges and changes to ways of working. And I imagine everyone on this call has had to adapt to virtual team meetings, client meetings, training, recruitment. So we've invited Jay here to share his recent experience with running virtual strategy planning session. And there'll be opportunity for probably 20 to 25 minutes of Q&A at the end. So please direct any questions you have into chat and I'll make sure that they're seen. In the meantime, please turn off your mics, and we'll probably finish around 8:45 today, but for those who want to stay on longer to ask questions, you're welcome to. So Jay, perhaps before we can dive into the virtual strategy planning sessions you ran, you can tell us a few words about the Commission and your role in it.
Yes, so morning everyone, and I see Margie said it's a nice cold day in Sydney, so it's currently 2 degrees here in Adelaide, so as well, so nice fresh crisp morning. So I work for the Commission on Excellence and Innovation in Health, which is a fairly new agency. It was set up on the 1st of July last year, and it was really part of a government promise, the most recent incoming government wanting to really think differently about how to drive significant change in the health sector. So they set up the Commission. We're a small agency, so we're currently 25 staff, and the remit is really as broad as driving innovation and excellence in health. So it's a huge remit that covers both the public and the private health sectors. It's an interesting space to play in because South Australia, I'm not sure what the other states in Australia are like, but South Australia in particular is very hospital focused. So we have to be careful not to only focus on hospital care when the large part of what happens in people's health lives is actually not in hospitals. So we've got a very big remit, but in lots of ways it's really exciting because it means that we can get involved in a whole raft of things, and the money that we've been given by the government is not to do continuous quality improvement, which organisations should be doing anyway. It really is to try new things, to think differently, think big, fail fast and safely, but actually just get on and try and make some step change in the health system. So that's a very whistle-stop overview of the Commission. We have 4 directorates, of which mine is one. So, they really describe what it is we do. So one of them is clinical informatics. So how do we do better with data, derive more insight from the data that we have, and understand where are the gaps in our data and try and plug those. So we've got clinical informatics. Another one is called consumer and clinical partnerships, which is really looking at how do we bring clinicians together with patients and families in the wider community, and do that in a much more structured, systematic way. The third one is clinical improvement and innovation, which is really the doing element. So we've got a team of project managers who will be out in the system actually making change happen. And then my role is as the Executive Director of Human Centred Design, which is twofold. On one hand, it's looking internally about making sure that all of the work we do in the Commission is done from a human-centred design thinking perspective. And so that's about our internal processes and methodologies, but also looking externally and working with the health sector to make human-centred design a normal part of what happens in health. So rather than going to people and finding out what problems are and then solving them on their behalf, really empowering clinicians and the community to co-design solutions together. So it's a very broad brush overview of who we are and what we do.
Absolutely, it's playing a hugely important role for the health industry and the community. And if I turn your mind back a couple of months ago, early April, you organised the whole team and a couple of consultants to have that full-day strategy planning workshop. I think a week before the workshop, we were getting news about organisations closing the office doors, obviously with COVID, and the night before the flights were actually cancelled. So can you tell us what was running through your head that night?
Yeah, it was tense. It was a tense time. There was a sense of drama that ensued. So we had planned to run a one-day workshop with our entire team, and there was some pressure behind getting on with it, because I mentioned the commission was set up in July. This is our first strategic plan. So we've had a team of staff for 12 months almost. And they're poised, waiting for a strategy to be developed, because that will really help guide who we are, what we do, and really importantly, what we don't do, because we've got limited resources. So people are waiting for this to happen. So there was some pressure to get on with it. And it was on, literally, the session was on a Monday, which I think was the 1st of April, actually. And on the Sunday night, we had to cancel because of COVID. So right up to the wire, we weren't sure what was going to be happening with the borders. So we literally had a sort of 24-hour period to try and turn things around. And what we absolutely knew is that we didn't want to just cancel. And lots of you will probably have been in the same boat, where a whole raft of things from diaries just evaporated altogether. We didn't want that to happen, because we'd primed the team to be involved in the strategic planning process. We also have a clinical advisory council, which is a group of about 35 people, all fairly senior and all very busy. So getting time in their diary to help get involved in a strategic plan was also really challenging. So we didn't want to waste that opportunity. So we had to really quickly rethink, how do we carry on with this, but in a virtual way. But it was literally turn on a knife edge. So it was great to be able to work with Alistair and the team at HFL to actually think how that might practically work, because we were a bit stumped originally.
And we're really role modelling the behaviours that the Commission is trying to demonstrate as well, in terms of thinking quickly and adapting. So
absolutely.
Tell us a little bit about how the virtual delivery was different to the face-to-face, and perhaps the top 3 to 4 biggest benefits you found of doing it virtually, and then we might go into each of those.
Yeah. So in terms of the logistics, rather than have a one-day workshop, which is what had originally been planned and what people are much more familiar with, we ended up having a series of 10 virtual workshops over 2 weeks. So they were, the shortest ones were an hour, the longest were 90 minutes. So they were still quite short bursts in time. And actually, I think, just in my own experience, having used Zoom and other virtual tools now for several months, a lot over the last several months, I think sort of 90 minutes to 2 hours is max, where you can really actually keep people's attention anyway. So we had short bursts, and each of the sessions had a particular focus. So in terms of the benefits of it, there were several key things. So one was that by having fewer, shorter sessions, it meant that people stayed fresh and had time in between to actually think about what they were going to input into the session. So they'd been presented with the agenda prior, so everyone knew what the aim of that particular session was. And it meant that we had people fresh each time. So you don't get to the point that you would in a one-day workshop, where by the 7th hour, people are actually just exhausted, and you're probably not getting the best out of them anyway, despite best efforts. So that was one benefit, is that we had people prepared and fresh and engaged, because they just simply had more time and preparation. One of the things that really stands out for me, and is probably the thing that would make me do it this way again in future, was that by having it over 2 weeks, people felt more part of a process. So rather than a one moment in time workshop for a day, which might be quite immersive, I think spreading it over 2 weeks gave people a sense that something bigger was happening. They were involved in a sort of longer, more detailed process. So what we got out of that, the outcome of that, is that people are much more invested in the resultant plan. So rather than just have one moment to feed into it, they've actually had 10 moments of being part of this development. So they the feedback we've had on the final document is that people really see their language in there, which for me is fundamentally important, given that the strategic plan is for our team, that's a primary audience. So that was the second thing. Another one was by having it in this way, we were able to be much more agile. So we actually changed the sessions or included sessions based on what was going on, into what was coming up in conversation, which is much more challenging, not impossible, but much more challenging to do in a one-day workshop where you have to be quite a skilled facilitator to pivot and go down a line of inquiry. A good example of that in terms of practical examples is throughout our strategic planning process, we developed up what we call our project selection criteria. So sort of a decision-making matrix, but not quite that staunch where it's how we will make our decisions, but it certainly guides what we will take on and what we won't. And we actually hadn't planned to go into that much detail on that, but because the team were driving that discussion, we were able to include a session just dedicated to talking through our project selection criteria. Similarly, we had a whole session on our culture and values, which was really critical. That was towards the end of our strategic planning process, and I'd had messages from team members nervous that that wasn't going to happen. So we were able to be really flexible and agile and make sure that all of the stuff people wanted to surface is what actually happened. So the ability to flex and be much more responsive was important. And then the final thing has a few different elements, but one, I suppose it boils down into engagement. So we had, by using virtual tools, I think we had much better, broader engagement from the team than we might have had in a workshop for several reasons. So one is that we used the breakout rooms and they were used really successfully. And each time we went into breakout rooms, the groups were randomized. So it meant that people couldn't just sit at the one table for the whole day with their little group. They were shuffled up. So everyone got to be working with other members of the team that they might not usually work with. And fabulously, we'd just appointed 6 new members of staff who hadn't actually started in the commission. So they, by nature of it being virtual, we were able to include 6 members of staff who hadn't even started. So that was a great way for them not only to get an introduction to the rest of the team, but they were all really enthusiastic to come straight into an organisation, into a strategic planning process. But one of the other things I think was important in terms of virtual engagement was using things like the chat function. So what we got were multiple layers of conversation happening that actually you couldn't allow in a face-to-face workshop because you just can't have lots of conversations going on all over the place. But what we had was people workshopping in the main group as we are now, but then we had sideline chats going on either to the entire group or people messaging one another. So there was this multi-layered conversation which virtual technology allows for really easily that face-to-face interaction actually doesn't. And so what happened is we had members of the team who are quite introverted being really quite engaged because it's easy just to throw a message out into the chat, versus the more extroverted people who are happy speaking up and sort of raising things verbally. So I think in a face-to-face session, you will always get the more shy, retiring people who don't feel as able to speak up. So my overall view is that we got much better engagement and so much better buy-in to our resultant strategy by doing it in this way. And I would do it again in future. I don't think I would ever have a single one-day workshop again.
Wow, it sounds like it's a blend in terms of the episodic nature, spreading it out so you can have that opportunity to flex and make sure everyone's staying fresh and engaged and involved over that 2 weeks, but also the use of the virtual tools where you're getting people to contribute that might not usually contribute.
Yes, and we did have people say, there are some people in our team who would have preferred face-to-face, and I think that comes totally down to personal preference. Some people will always enjoy airtime with other humans, but what was interesting is even those people that said they would have preferred face-to-face were still really engaged in the virtual discussion. So they were probably the more extroverted people, so they were still totally engaged, but just missed having actual, contact with other people face to face. But I think it certainly wasn't a barrier. If anything, it made the whole process better.
And in terms of the outcome you were looking to achieve at the beginning, so the collective vision and the plan, how did the virtual approach change that outcome, if at all? You get what you're looking for?
Yes, absolutely.
Yeah.
So I think in terms of the practical output, which is a documented plan, that we would have got had we have done it as a one-day workshop, because really ultimately what we're after is a document, and you can go backwards and forwards as often as you like, tweaking the language until people are all collectively happy with the language. So we still got what we were looking for in terms of a document. What I think was better than what we anticipated, and certainly we hadn't expected it to go so well virtually, so we were pleasantly surprised, but I think it actually worked better than a face-to-face workshop, is the investment and buy-in to the document. So that is much greater because people have felt more part of its involvement. I think by having this episodic, iterative approach, people are much more invested and can see themselves in that strategy document, which for me is the fundamental point of it. We want that document to be a collective articulation of where we're headed over the next few years, and that's exactly what we've got.
Absolutely. I think so often you can have people thinking strategies, conversation that happens at the top of the organisation. No one perhaps has as much input, being able to see their own language you mentioned earlier on. I think it's pretty important. Grant, I might just check in with you whether there's any questions.
There are a lot of questions,
okay.
Yes. So if we for people who sort of haven't attended these meetings before, we use chat to keep track of questions, because it means that the moderators don't have to keep looking in a window, but it also means that I've got to keep up with everybody's reading. So Gail has asked, I will get through everybody's questions, maybe not in quite the order they were asked, but Gail has asked, it sounds like the virtual format was spread over more hours in total than a one-day workshop. Was that planned, or did you add extra sessions as the discussion progressed?
Most of it was planned. So we did add a discussion. We did add a session, like I mentioned, about our project selection criteria. And I think that it was actually fabulous to be able to do that. So absolutely, you're right. We spent more hours with the team than we would have in a one-day workshop. And I think if I was to do it again, I would actually follow a very similar process, because I suppose what you need to plan out is the overall time that you've got. So because the world had changed so dramatically and our deadline had essentially disappeared, it meant that we were able to allow a 2-week period, and we had time enough to actually get the sessions into people's diary, which is important. So I think if you've got the time to allow, then having those smaller, fewer sessions over a longer period of time was a really successful thing to do, and allows you to do exactly that, to be responsive to the conversation and add things in.
Great. We've got a number of questions about how the technology worked. Joe's asked, did you leverage a co-authorship approach to the strategy document, letting multiple contributors work on it at the same time and extending the number of collaborators?
So the short answer to that is no. We worked with HFL to develop up the draft document, and then that came to the executive team. We played around with the language and then sent it back out to the team. So we didn't co-design the document using Google Documents or anything like that. And that was probably intentional. So I think rather than have a fully open approach to getting that bit right, we did want to put a bit of pressure on just getting through our process. We do have some time pressure, although I say the deadline did disappear. We do still have to get our plan finalised, released for public consultation as a public agency, which is happening at the moment, and then it has to be signed off by the minister. So we do have some pressure to sort of get it completed, which is why we didn't really have a total co-design approach for the language in it. But certainly the team have been involved in giving regular feedback, and we were able to check in throughout the strategic planning process. We were able to check in with people to make sure that all of the things they wanted to be discussed and covered were. An example of that as well is when we were developing up our team culture and behaviours, bit of the strategy, we sent around a survey to people, and actually the survey went to HFL, so it was one step removed from the executive team at the Commission, which was important to give people safety to be honest. And that the survey was really about, tell us what about the team culture you think is working and what isn't, and how do we improve it. So it was important that we gave people space to be honest about that.
Okay. There's actually two questions here, but they're kind of the same thing. M. Daly has asked what the tech used for the breakout rooms was, and Francine has asked if there was other software integrated into the process, like polls or breakout software beyond Zoom.
No, so we used Zoom with breakout rooms. We didn't integrate any other software like Miro or Mural. Actually, and I've only just myself seen a Zoom poll for the first time last week. So I think were we to do it again, then we probably would integrate other software. So I think having actually a really good example of this, recently we hosted something called the National Innovation Games, which made use of Zoom, Slack, and Miro boards for virtual whiteboarding. So it was quite full on managing different platforms, but actually it worked really well in terms of getting people's engagement. So I would probably at least build in the electronic whiteboard function where people can craft ideas together outside of just verbal discussion.
Okay. We have a terrific question here from Joe, which I'm actually going to leave for, I'm going to just finish the technology stuff because we have a few of those in a row. Margie has asked, were the people who were attending actually comfortable with the technology, and how did you set this up on such short notice to encourage and help people to encourage and help people to contribute to the sessions?
So in terms of people's level of comfort with the technology, that was very much a learning curve. So it was more, it was a bit of a baptism of fire because we just had to do it. If we were going to do it, it was going to be virtual. But I suppose some of it was actually taken care of for us, which is a silver lining to a global pandemic, unfortunate circumstances, but some good came out of it. And that almost overnight, the office went from working in the office with people struggling with VPN access and remote access from home to almost overnight people had new equipment, they had global VPN access to the system, which on the one hand shows that when the pressure is on, we can actually make change happen really, really quickly. So lots of the things that otherwise might have frustrated people had been resolved by virtue of the Department of Health's IT just completely revamping themselves overnight. But then I think it was more the familiarity. There were people still getting used to how Zoom works. But well, all of you obviously have used it, and it is a fairly straightforward platform. I think even things like the breakout rooms, one of the benefits of the virtual technology is the facilitators can take complete control of that. So people aren't having to sort of find their own room or really navigate the system. It's just a matter of clicking, yes, admit me, or go back to the breakout room. So they are fairly user-friendly anyway. But technology-wise, we didn't really run into any problems. You always get the odd niggle with people's connectivity is probably the biggest issue with people's internet staying stable enough to let them actually engage properly.
Joe's asked the killer question that we always used to ask in interviews when I was a journalist. What didn't work well, and what did you have to change along the way?
What didn't work well? I think, let me just ponder that for a moment. I can't really say that anything didn't work well. There was nothing I thought, oh, that was a failure, or we didn't get out of it what we wanted. Something perhaps that I would have liked to have done more of was our sessions with the Clinical Advisory Council. So I mentioned this is our peak body for advice with our 35 people, and it's an amazing group of people actually that we've got the pleasure of accessing for their advice. And we had 2 short sessions with them, so 2 90-minute sessions. We had planned a more detailed workshop with them, but I think I would have liked to have done more with them. I think the team, certainly with the team, I think we got more than what we had hoped for out of the process. But in terms of our wider stakeholder engagement, personally, I miss just being with people and really having time to delve deeply into things. So it felt like a bit of a light touch in terms of getting the advice from our advisory council, I would say.
Okay. Linda's asked, we have a lot of questions about the sort of content and the format as well. Linda's asked, what activities did you did you assign between sessions?
So there was not so much homework in terms of getting people to do things, but definitely getting people to think about what it is that they were going to contribute. So if I run through our agenda, essentially, so I'm not going to get all 10 sessions correct, so I don't have the list in front of me, but I can, if any of you want me to write to you with what the 10 sessions included, then I'm very happy to do that. But the general flow essentially went some background information, talking about some fundamental principles of how we want to work. So, you know, what are our strategic imperatives? And then, interestingly, we had 4 of the sessions devoted to each of the directorates. So myself and my 3 other colleagues at executive director level presented our vision for our patch of the Commission's work, and had that stress tested, in Alistair's words. So basically you're put in the limelight on the spot and just having people quiz you about where you think the direction for our own directorate was. And those sessions, so again, people knew in advance what they were going to be listening to, and we each had to prepare a presentation. The feedback that we got from those was really fabulous, in that one, it's a moment of nervousness for us being in the limelight to your own team, but actually people asked that we had have started with that. So we'd started with, you know, let's shape our collective principles, and actually what they wanted to do was flip it, because the team essentially came back to us and said it was really fabulous to hear from the executives what your thoughts are, and then we can tell you whether we agree or not, essentially, and then from that collectively decide what it is we want to do. So that was quite a fun process to be part of. And then we got into our culture, our values and behaviours, which I'm an anthropologist by background, so sort of talking to people about culture and behaviour and being provocative about those things is what I enjoy a lot. And interestingly, that's the sort of space where I think often people think you would have to do it face to face. You know, there's something about dealing with human behaviours that feels like it should be done with humans in a room, which is completely not the case. So we've proven that you can equally have those sorts of conversations virtually, and we're able to get to a point where we've got a framework, a behavioural framework that sets out the behaviours people want to see in their colleagues and those that they don't want to see. So it's actually quite a detailed piece of work in a one virtual workshop. And then we sort of had a wrap-up session to bring it all together. So that was the flow of how the sessions played out.
How many people were in the sessions? And could you talk a little bit to, you've mentioned that there were 6 new people who were literally starting. I mean, could you talk a little bit about them? Were they starting that day, or they had been there a week?
It was amazing. They hadn't even started, so they were participating prior to their start dates. We were just lucky that they were allowed the time from their previous roles, or they had already left their previous roles to take part. So we've got a team of 25 people, and that's made up of the leadership team, which is myself and 5 others, including the Commissioner, 3 other executives, and our business operations manager. We've got administrators, and then the large chunk of the rest of the staff are project managers of various descriptions, and our clinical informatics team, which is made up of data architects, data scientists, engineers, etc. So the clinical informatics team is very new. So we had literally appointed 6 of them into various data scientist roles, and they were the ones that participated before their start dates. So, which was amazing. And they were so engaged that I think the rest of the team was quite wowed by it, that these people had come, not even had they said hello and here's your colleague, meet your colleagues, they'd got stuck straight into where do we want to be headed over the next 3 years. So that was an amazing experience to engage them. But we had all 25 staff engaged the entire time, so very few people missed any sessions, if at all.
Okay. Within the meetings, how did you manage the sort of power and politics? Like, did you have to, you have mentioned sort of introverts speaking over chat, but did you have to have formal ways to draw out commentary from quiet people? You know, was it an enormous difference from running a face-to-face meeting, or was it a lot more formal?
I think it was much less formal than running the face-to-face meetings. I do have to give kudos to Alistair and Darren for their facilitation, because they were very good at telling the executives to back off. So we were under strict instructions to do more listening than talking. And actually what worked really well, which I have plagiarized shamelessly and used in virtual sessions myself since, is each time we went into breakout rooms, the first task is to nominate a facilitator and a scribe for that breakout room, and neither of those roles was allowed to be an executive member of staff. So we very much took a back seat and allowed the conversation to happen, or obviously participate in the conversation. But actually all of us were very conscious, and that was intentionally, because we were reminded that we were not in the driving seat. This is much more allow people to speak and be part of listening to that. And then we can, which is why then the plan came back to us to sort of crystallize into something. And it worked really well. So I'm putting words in the mouths of the rest of my team, but I would hazard a guess that people felt very able to be honest. I think having the survey halfway through about the team culture and have that go back to HFL so that we only got anonymized results, I think was also a very good way to allow people to be upfront and honest. But certainly the conversations we were having in the virtual sessions were very open. People were very engaged. I don't think there was a real sense of power and hierarchy. Certainly nothing happened that made me feel that we'd overstepped in terms of exerting executive pressure.
Okay. How important do you think of a goal has to be to justify doing episodic meetings?
Ask me that question again.
Okay. How, if you're going to be running something as a sort of, you know, over a number of days and that kind of thing, how big an issue does it have to be before that becomes a good way to run the meeting? Like, you know, are there sort of levels of meetings that you'll always run as it's a one-off? It goes for 3 hours and that's it, or do you think this could work for everything?
I think it could work for everything, and it probably boils down to the level, partly the time pressures that people are under. So most people work in a context of everything has to happen yesterday, so often you don't get the luxury of saying we're going to spend the next 2 weeks doing our strategic plan. It's easier to block out one day. And actually, especially for clinical people, our team's a bit different because they're not providing patient care, but certainly in other parts of the health sector, when you're running workshops, if you're a clinical member of staff, it's much easier to get someone to backfill you for a day than it is to be released for 2 hours a day for 10 days, basically. So there's some logistical things that make it challenging if we were to do it again. I think coming to your question, Grant, about how important does it have to be, if it is something where you really need people to be bought in and engaged, then I would do it this way again, because that's, if I had to crystallize one thing that I think was the most significant benefit, it's that people really feel part of the strategic planning process and are bought into the plan as a result of having this episodic more time together to create it.
Okay, thank you. So I've got a quite tactical question from Margie, and then a really interesting long-term one from Gail. From Margie, did you notice any changes with people's engagement with the sessions or their motivation increase or decrease as more sessions were rolled out?
The not so much changes in motivation. So everyone was actually really engaged throughout the entire process. I think having the team members, our clinical informatics team, engaged before they'd started was a real a sort of unplanned win for engagement, because people were really excited. The team that were already there were really excited by that. They were completely amazed at how well these people were engaging, and they were getting to meet their colleagues for the first time virtually. So actually it's only been in the last couple of weeks that people are meeting face to face for the first time. So that's been quite cute to watch people filter back into the office and say, oh my God, I'm actually seeing you in person now. You look much taller. So that's been quite fun. Yeah, I think so. I wouldn't say there were changes in engagement. It was really positive and solid the whole time. But that was a bit of a win that I think the clinical informatics team, by being able to participate, just buoyed up the rest of the team to think, isn't this fabulous that we can meet our colleagues before they've even joined the organisation.
Jay, what did get you to involve everyone in the first place?
It was really just a personal choice that, we wanted to create a strategic plan that was the team's. It's their strategic plan. So we, as a leadership team, we're absolutely not about doing a top-down approach to what goes on. So we want to intentionally make sure that there's a very flat hierarchy, if one at all, in the commission. We've done some practical things to make that happen. So for example, myself and another colleague have moved out of our glass offices just to join the rest of the team on the floor. So we're very conscious about wanting to have a really democratic and engaged team. And so I can't imagine doing a strategic planning process that didn't involve them. I would always want to start there and have them co-create the plan for themselves, really.
Yeah, it's a great start.
So I think Gail's asked probably the killer question of the session, which I think everybody here is probably thinking about. When we all go back to the office, how do we keep the gains in terms of broader contributions that we get with virtual meetings? I don't want to go back to sitting in a large meeting room with only senior people being bold enough to speak.
That is the killer question, and I know almost daily I have conversations about this. How do we keep pandemic conditions without a virus? So I think one thing I hope stays changed is certainly going to be domestic travel. I think what this does allow is for us to engage with people much more easily without the barrier of having to move around the place. So for example, I'm talking to you from Adelaide, and this is actually supremely easy than having to fly me to Sydney or drive, etc. So I think our ability to engage with people much more broadly will hopefully stay changed. What's been interesting in the office, where we are co-located, so we've been starting to filter back into the office, and we're keeping a policy of just letting people choose where it is they want to work. If people want to carry on working from home, that's absolutely fine. And it's actually much more incumbent then on managers and leaders to make sure that people are achieving their outcomes as opposed to their hours. So there's been this philosophical shift where we don't really care about bums on seats. It's, are we achieving good work or not? And when and where that happens is largely irrelevant. So that's something that we want to hold on to, which is a sort of proactive approach that we're taking. It's not structural, so there's nothing that's sort of set in policy to make that happen as yet. I'm not sure totally that it needs to be, but that stuff always helps when you've got differing managers' views about things like working from home. So I hope that stuff stays changed. One thing that happened when I was in the office last week is that we'll have to prepare ourselves for. There's actually a challenge now in open plan spaces in particular. So we've got a single floor, very open plan, and actually staff now that are in the office are struggling a bit with the virtual technology, because you can't go into individual meeting rooms to plug yourself in. And even though you might have a set of earphones in, there's still a lot of background noise. And now if you've got 12 people around you all on Zoom meetings, it actually does get quite noisy. So we've got the next challenge of how do you facilitate that sort of engagement going on in an open plan environment where everyone can still carry on participating virtually. But I don't think there's an easy answer to your question, but I certainly hope that this way of engaging carries on, because it's just infinitely more practical, especially, like I say, when you're trying to engage with people over a distance.
Awesome, thanks. So we do have a soft stop at 8:45, so for those that need to leave, please do, and if anyone has further questions, we will be taking some more questions.
So we have a couple of comments here. Margie's actually said thank you for sharing the story. It's a great example that demonstrates what your team is all about, being innovative, pivoting quickly and using the experience to learn and improve.
Thank you.
The other person in this office who, funnily enough, is actually in the next room so that we're not listening to each other's Zoom conversations, which is Alistair, has said that we have to end the hippo effect, the highest paid person's opinion, which I've always been very keen on. And we are sort of we will keep running after 8:45 if people still have questions, but if you have questions, please send them through now so we can sort of make sure everybody gets heard. One that we have had from Joe is that the government is pushing Office 365. Did you consider doing this through Teams? We've actually had a couple of people who have tried to come on these webinars, sorry, one person who's tried to come on this webinar who wasn't able to be on Zoom calls that were being recorded. So, you know, I can see that this is definitely an issue for some people.
It's a huge lost opportunity for Zoom, because they didn't sort themselves out quickly enough in terms of security. So yes, so the government here is pushing Teams as well. We didn't consider using Teams for this process, and that's largely because of it doesn't quite have the flexibility that Zoom has. So I've not used Teams where you can actually facilitate breakout rooms, for example. That may be possible, and I just haven't done it. But one of the big barriers, which seems a small thing but does make a huge difference, is that at least then, when we were going through our strategic planning process, the most people you could see on Teams was 4, and I know they've since changed that. But actually having the gallery view is really important. There is something important about being able to see who it is that you're talking to in the virtual room. And we've been running a series of compassion labs, they're called, for the health workforce, which are again, they're 2-hour Zoom sessions over a few weeks, really to talk about self-compassion and how do we sustain compassion towards other people. And it's mandatory that people attend those with their video on, because we want human connection. And Teams didn't allow that then, certainly. So that was it seems sort of small and semantic, but actually made quite a big difference.
Lee's actually pointed out that there are no breakout rooms in Teams as well.
Yeah,
so
I didn't think so. I certainly haven't used them in Teams.
And Joseph has pointed out that if you are having lots of people doing Zoom conversations in the same room, you should try some noise cancelling software called Crisp.
Oh, brilliant. Thank you.
KRISP.
Okay, fabulous. Thank you.
So I think we're kind of running to the end of this, I think. So, Jarrad, the sort of other question that we always ask is, what should we have asked you about? Is there anything that you'd sort of like to talk about that hasn't actually been asked?
No, I don't think so. I've been giving this a lot of thought, obviously, since knowing that I was going to be having a chat with you all. And I do think that were we to do this again, well, I don't think I would ever again have a one-day workshop for a strategy session. I might do things face to face. I might use virtual technology. Certainly, I'd probably actually do a mixture of the two in future. But I think we got so much more out of breaking this up into multiple segments, and which is it's an exercise in planning, because in future, and we'll obviously be doing our strategic planning processes in future, I would make sure that I allowed myself enough time to have this episodic approach to it, because I think it worked infinitely better than a one-day workshop. We got so much more out of it. And as a team building exercise in and of itself, it becomes a team building exercise, which was fabulous.
Fantastic, thank you. So I think Alistair has been asking me quietly if he can say something. Al, go ahead.
Yeah, sorry, I have managed 46 minutes without coming on and saying something, which is, as Kirsty and Grant will tell you, is a world record. I mean, I just want to make a couple of points. First is, and I know there's quite a few consultants on the call, it is massively more intensive for the consultants. It takes way more time than doing a one-day thing, because but for all the benefits that Jay's just been describing. So Jay and I talked after every session, what went well, what would we do differently, what did we learn. We were able to do these check-ins in between sessions, and a couple of you were asking, you know, how did we manage the dynamics? And I really emphasise the point that Jay's just mentioned there about being able to see all 25 people on Zoom in the gallery impact. So anyone who looked like they were looking at their phone or doing their email, I would pick on. And very, very quickly, people got to understand that, you know, they've got to be on all the way through the 60 or 90 minutes. But from a consulting perspective, don't imagine that it's easier. I think it's, you end up with a much better result, but from a time intensity perspective, it's significantly harder. And the only other thing I wanted to really mention was that the executive team were really well behaved. And as all of you who are consultants will know, very often the executive team are the least well-behaved group of people on the facilitation, and particularly the most senior person, i.e. the top hippo, is someone who wants to get involved in long and windy answers all the time. And the commissioner in this particular instance was extremely restrained, but we made sure that we brought him in to finish, you know, at the end to make comments. And none of it really would have worked had the commission not taken this really inclusive view about involving everybody in the strategy session and that team building that Jay's been talking about. And, you know, even to the extent of people who have not yet joined, that was such a big deal for those people. I don't think you can emphasize it enough. So I'm with Jay. If somebody asked us to design a one-day workshop for strategy, I wouldn't do it on a one day. I'd do it episodic. It gives people time to reflect in between. For those people who take longer to process, it gives them process time so that they come back having understood stuff. We were able to build a deck as we went through. So before every session, they got to see the results of the work they did in the session before. I mean, it just worked really beautifully. And they were able to see what they'd contributed in the last session, actually there documented and as part of it. So virtual for this type of thing, I think is really, really the way to go in the future. That's all I wanted to say.
I think we're probably just about ready to wrap up, but can I just jump in with, there's been a couple of comments in chat about whether you can use breakout rooms in Teams, and I know some people here are using it, so that would be useful. Haley's Googled it and found that they may have developed an option, but Claire has actually developed what sounds like a very complicated, or very useful technical runaround for it, which is you can run concurrent meetings and switch between them. One meeting goes on hold while you join another, as long as you don't hang up. I paste and rename links and chat functions to support switching between rooms. I could see myself doing that and completely blowing that up, Claire. But thank you for the tip. I think, and sorry, there's one more question, and then I think we probably should wrap up. But Petrea's asked, Alistair and Jarrad, can you see a one-day event where it would be preferable to the format discussed this morning?
Where might a one day, I think if you had a singular topic, so for example, we're running a workshop, which is going to be virtual, we're still in the virtual world, around how do we measure patient experience, basically. And we've got a multitude of stakeholders, probably about 80 people coming to that workshop. And that could quite easily be done in a one-day face-to-face session. So physical proximity allowing. But I think if you had a singular topic and you just want some dedicated time to smash it out, then that you could do in a one-day workshop. I think with something like a strategic plan where there's multiple components and you want people to actually have you want them to be fresh and engaged around multiple different topics in the one process, I think that works better doing it in an episodic way. So it probably depends on how many elements you've got to focus on.
Awesome. Thank you so much for sharing your experience, Jay, and also the great work the Commission does. I think that's it for now. The recording will get sent out, and if anyone has any further questions, happy to direct them to Jay, Alistair. We can connect with them on LinkedIn.
Yeah, I'm very happy for people to contact me. I'm happy for you to share my contact details. If anyone wants to discuss it in more detail, then feel free to get in touch.
Fantastic. Thanks, Jay. Thanks all for joining. Enjoy the rest of the day.